all your thoughts a fighting chance. Ask your fears and doubts. Would you like to dance? And open up your eyes. See the world and let the world see you. Take the time to love the things you do, and you hear it when your spirit starts to rise.
Hello, I'm Christian O'Neill. Welcome to Paths to Wellness. This is a show where we provide our audience with information about the wide variety of approaches to health and healing that are found throughout our society. You know, in the United States, when most people say they're going to see their doctor, they mean an MD. But there are many people who prefer to receive their health care from an ND, that is, a doctor of naturopathic medicine. Our guest today, Karla Koch, is such a practitioner, and she's here to share her knowledge of naturopathic medicine with us. So, welcome, Karla. Thanks for coming.
Thanks. It's a pleasure to be here, Christian.
Okay, now some people in our audience may not be familiar with naturopathic medicine. Could you perhaps sum it up for them?
Sure. Naturopathic medicine is, we tend to use natural therapies, as implied with the name. And we have 6 basic principles that our medicine is founded on. The first of which is nature cure. So we believe in the innate ability of the body to heal, and we just need to remove obstacles to that healing. We believe in prevention, so really looking at the risk factors someone's prone to and making sure you're addressing those early on before they become outright disease. First, do no harm is another one, and that includes both diagnostic techniques as well as treatment techniques. Treat the whole person, so recognizing the interrelated body parts, mind, body, spirit, as well as we don't just treat the heart or just the gut, we recognize that everything needs to be working well together. Mm-hmm. Doctor as teacher, so educating the patient is really important, really empowering them to be able to take charge of their own health. And finally, identifying and treat the root cause of disease. So we're not symptom focused. We want to help with symptoms so that people can be more comfortable, but we really want to get to the root cause and correct or reverse what's going on.
Mm-hmm. Okay, so what are maybe some of the main areas of education that you're doing with your patients?
Especially diet and lifestyle changes and how those affect our body. So it's even on a moment-to-moment basis. When I eat this, I feel that, as well as over time. So those are more subtle things. Okay. And then exercise, of course, is part of that. And
you said in the beginning, pointing out the obstacles that are standing in the way of wellness. What are some of the common obstacles that the patients that are coming to see you are presenting with? Some
of the big ones, and it's not just in the West, but really all over, is the way we eat. And that's especially a problem in the United States, which I think is pretty obvious, our dependence on fast foods, on sodas, on quick relief and not eating as many vegetables and fruits as we need, learning about healthy fats versus unhealthy varieties of fats, and the sources of your food, where you're getting it from. Making sure you have a good exercise program that works for the individual, so that can be quite different from person to person that walks in. And other obstacles can be our environment. So here in Albuquerque, we have a really hot and dry environment, and how does that affect us, and how do we have to modify our lifestyles to deal with that?
Okay. And so the name of your practice is Salubrious Natural Health Care. It's an interesting name. How did that come about?
Well, I really liked the word salubrious. So it's a Latin word that means, it's an English word, but it's Latin based. It means health or healthy, just like salud. And then brio, which means vigor or vitality. So putting those two words together, it really represents my goal for every patient, to have vigorous, vital health.
Excellent. You know, that's interesting because one of my idols in Western or conventional medicine is Patch Adams, and on his website he defines health as not the absence of symptoms, but a day-to-day vitality for life.
Exactly. Yeah. That's exactly what our goal is.
Mm-hmm, that's nice. So, okay, so like we were saying in the beginning, a lot of people have some understanding of conventional or Western medicine. What are the similarities and differences between the conventional Western approach and the naturopathic approach?
Some of the big ones are our education in the beginning is really similar. So first bachelor's degree, then a 4-year postgraduate medical degree. The basic sciences are virtually identical. And then we dive into totally different types of therapeutics and somewhat different diagnostics, but the diagnostics are pretty similar as well between both naturopathic and allopathic or conventional medicine.
For instance, is there a role for imaging? Would you order that?
Definitely. And I don't personally order it that much. That's a place where I would refer to someone, and that's mostly based on insurance type of setup and kind of the setup of our system of healthcare in the United States and especially in New Mexico.
Okay. So those are some of the similarities. What are maybe some differences?
So the therapies that we use are really quite different. In allopathic conventional medicine, there's a focus on medications, drugs, and surgery, whereas in naturopathic medicine, we're using a broad range of natural, non-toxic types of therapies. It includes, as I mentioned before, diet and lifestyle changes, mind-body medicine, homeopathic remedies, herbal medicine, and the list goes on from there. Acupuncture can be a part of it.
Mm-hmm. So as part of your training in a naturopathic school, homeopathy is pretty much, is that a consistently seen practice throughout the naturopathic schools?
That is. And some schools do emphasize it more than others. Some schools emphasize acupuncture more than others. There are some individual differences. And then there's also the individual practitioner. You know, we're all drawn to certain therapies more than others. Some naturopaths are very into mind, body, or physical medicine, and others are really into nutrition, lifestyle changes. You know, there really is no limit to the number of therapies we can do.
And tell me a little bit more about mind-body medicine. I've heard the term. I'm not too familiar with that.
It's making sure that the person is on track in terms of how they're feeling, how they're thinking, and how that affects their body. So if you're thinking negative thoughts all the time, if you're not sleeping well, you're not going to be digesting well because our mind affects our gut and how we're dealing with our food, how are we absorbing our nutrition then. So making sure that people are on track and are doing what they need to do to be in a healthy mental space.
Is counseling part of your practice? Would you go that far to say you're counseling your patients?
I am not technically, like I don't advertise that I do counseling, but that's definitely part of a physician-patient relationship, and in naturopathic, probably a lot more than allopathic medicine, partly because we have a lot more time. We can really get into what's going on in your life, in your world, and I spend an hour per patient. So that gives me that chance, and part of that is nutritional counseling, lifestyle counseling, but part of that is definitely mind-body. If they need to do meditation or yoga or something that calms the system.
Okay. So I actually received some treatment from Karla. I've had a cranky right elbow for several months. I probably have some tendinitis. And I never had a specific injury, but it's just been inflamed and hurting for several months. So Karla was good enough to treat me for that. I went to your office a couple weeks ago. Maybe you can just kind of walk us through what we did.
Sure. So one of the first things we did is looking at different remedies that might help with the elbow. You were interested in maybe getting some homeopathic combination injection therapies, and there's a variety of different ones that could be helpful. So I did some muscle testing, which is basically asking your body which one is the one that's going to work best for you amongst these 4 remedies that made sense to me to test for, to check. And what we came up with is that one called Traumeel from actually a local company in Albuquerque seemed to be the best one for you, at least on this day. And that could change. Your next appointment, it could be a different one. But Traumeel helps treat traumatic injuries, and they can be mild, and they can also be chronic repetitive injuries like a tendonitis would be. So then I draw up the remedy and using really tiny needles. These are actually insulin syringes that I use because the needle is so small. And then injecting that into points around the elbow and acupuncture points. And as as a homeopathic remedy, it's an energy-based medicine. It tends to combine really well with acupuncture. So as two modalities, even though they come from very different foundations, theoretically, they actually work really well together.
So I came in on a Friday. Oh, no, now first of all, there were some other, you gave me the injections, and there was some other advice that you provided me.
Right. With tendonitis or with any inflammation in the body, I'm going to recommend an anti-inflammatory diet. And that includes, it's really a healthy diet, but having a lot more fruits and vegetables, really focusing on those, organic whenever possible, and cutting down on meats in particular. And for some people, cutting down on dairy is really important as well. So that's kind of a general anti-inflammatory diet. Also, alternating hot and cold treatments is a really powerful anti-inflammatory. And you always want to start with cold and end with cold. But doing just a couple minutes of each, alternating, forces the blood in and out of the area and really lets you heal faster.
And also, I seem to remember, give it a rest.
Oh yes, that was
that's
an
what
important part too, especially that day and for the next few days.
Right.
Not to work it too hard.
Yeah.
And you promised me you would.
I do seem to remember promising you that. Okay, so doctors are notoriously the worst patients, and this is what happened. I left Karla's office and I went right home and started in on some pretty heavy construction work. We were pouring concrete at our house. So I did that immediately after I left the office, and then I went to martial arts. And then the next day I went back to martial arts again, which is really hard on my elbows. And then on Sunday I actually rested, and then on Monday I just started martial arts every day. And so what my experience with the therapy was, on Saturday there was really no change. Sunday and Monday I felt considerably better. I was driving down the road, I think it was on Monday, and I thought to myself, wow, my elbow feels so much better. The edge was completely taken off. I think I could still feel the same area, the tendon that's sore, but it was considerably better. And I was like, oh, this is great. You know, I was so excited. It's been bothering me for several months. And then the next day, I would say it started coming back and pretty much got back to about the same level as it was before. So the next step, if I were to come back and see you again, I think I can say the first step would be I have to be compliant, just like with conventional medicine. If you don't comply with it there. Oh, and I never did the heat thing. I didn't do that either. So, okay, let's just assume that I've learned my lesson. I'm going to be more compliant. Now, what would our next step be?
There's a good chance, because you did have the positive response, that we would do the same or very similar treatment. And ideally, we would do it before the pain came back completely. So during that window when it was better, and get you back in the office, do another treatment, and try to ward off it ever coming back. Because there tends to be a healing and then a decrease, and then a healing and a decrease. And we want to minimize the time between so that you actually just get to healing, consistently, and then the problem hopefully doesn't come back. With a chronic injury, it's much more likely that you need a few treatments.
Okay. What are the main conditions that you're treating in your practice?
I see a lot of chronic and complex cases. So things like chronic fatigue or fibromyalgia that Western or conventional medicine doesn't have much of a role to play. It's like they don't really know how to treat it other than trying to cover up symptoms. And then complex things in terms of even someone comes in with menopause symptoms, but they have a lot of digestive complaints too, and maybe joint pain, and they're not necessarily coming in thinking that that's what they're going to get treated, but I'm going to look at everything together.
Now, chronic fatigue and fibromyalgia, I'm very interested in those conditions because I would agree that, at least from my training, they do seem to be poorly understood by Western and conventional medicine, and I think a lot of people do suffer from them. And I think you're also right when you say that it's really just symptom control. Maybe you could be a little more specific on that one. What would a naturopathic approach be to fibromyalgia and chronic fatigue?
Well, if anybody tells me on the phone before, as they're setting up their first appointment, that's what they're coming in for, I'm really going to encourage them to do a detailed health history before they even come into my office. So I can look at all those factors I was talking about: digestion, sleep, nutrition, lifestyle habits, exercise, how's their energy level and what changes. And it's such an individual treatment. Based on what I'm seeing on those pictures, I know, do we need to look at, is there heavy metal poisoning maybe? Do we need to really focus on the mind-body approach? Do we need to focus on digestion? So it's very individualized treatment in those cases. There's not a one-size-fits-all. There are some commonalities as well, and things we can do symptomatically to support the treatment.
Homeopathy, potentially?
Yeah, homeopathy, acupuncture can be great. Nutritional, like focused nutritional therapy, which can be supplement based.
Yeah, I have some experience with chronic fatigue and fibromyalgia, and I lump them together because I do think they're on a spectrum a little bit. And I can see the mind-body medicine playing a particularly important role, at least in my understanding of it, because I think the chronic stress, at least some of the literature I've read talks about the adrenal releasing the stress hormones, cortisol, etc., kind of a chronic tense state contributing to the symptoms. So,
and sleep is a huge factor in that condition. But it brings up also that we do a lot of hormonal imbalance treatment, and starting ideally by treating the glands themselves, adrenals, thyroid, the sex hormones, and the glands that produce those. But if we need to, we can go to bioidentical hormone therapy as part of that treatment. Infertility is another big thing that I feel like we play, as naturopaths, we can play a really big role in supporting someone really returning to health.
Excellent. Okay, so are there some conditions that maybe don't lend themselves well to treatment through naturopathic medicine?
Well, the big things that I would say naturopaths are missing in their training is emergency medicine. We do have some, but it's not extensive. I don't want to be a first responder in an emergency situation. I'd much rather have a paramedic there. And then we're not trained in major surgery. We have some training in minor surgery. Depending on the state that we're in, we can do that or not, but I'm certainly not removing an appendix or anything larger than that.
Okay, so in some states, minor procedures, naturopaths are licensed to do. I'm guessing maybe toenails,
exactly.
Stuff like that. Okay.
Lipomas, cysts.
Sure. Okay. I had a lipoma removed from a surgeon. It would have been, he was great, but it would have been nice to be able to go to the local naturopath and have that done also. So, okay, I hear what you're saying about the emergency type stuff. There's a local MD who, on his website, I liked it when he was saying that Western or conventional medicine shines if you're having crushing substernal chest pain. Go to the emergency room. Like you said, the major surgery, but it sounds like in some other conditions, many other conditions, naturopaths have a lot to contribute.
Right,
Yeah.
and even in an emergency situation, I would say we can contribute, we can play a supporting role, we can help you get back on your feet faster, recover from that surgery or that crushing chest pain, and especially with prevention, but even after it's happened. But those are supporting roles, not the primary role.
Okay. Now, Karla, in addition to being a doctor of naturopathic medicine, she's also a doctor of Oriental medicine and a registered nurse. So maybe you could share with us a little bit of how those other modalities inform your practice.
Well, naturopathic medicine is a Western-based medicine, similar to allopathic medicine. So we're using the same types of research and articles and viewpoint of how the body works. Chinese medicine is completely different. It's this whole other viewpoint of the body, and the interrelatedness is part of that too. But I really value having that. It's like this beautiful artwork looking at the body in this different way, and it also opens up a lot of different options in terms of treatment. So no treatment therapy works for everybody with a certain given condition. I really like having those different options. And acupuncture, I never want to have to give up having this magical, really effective and safe medicine in my disposal.
What about nursing? That must, you still work as a nurse now, so it must be part of your practice. What does that look like?
Really, it's with nursing, it helps me stay in touch with what's going on in the allopathic world. In the hospital setting, I'm really familiar with the pre and post surgical things and what's going on in the body there. So I I can be a person who understands what my patients are going through as they go through that allopathic system, and more familiar probably with medications than I would otherwise be. So, and of course doing IVs and blood draws and things like that, and which is always nice.
You do take blood samples in your practice sometimes?
I do, and I
Okay.
give nutritional IVs and chelation IVs. So my patients really appreciate that I can do it fairly proficiently.
Right. I guarantee you, if one of us was going to start an IV on one of the viewers, you would prefer it to be Karla. Starting IVs was never not my forte, so that's nice that you have that experience. Maybe you can tell us, I think the audience might be interested to know, is there a case or two that stands out in your mind that was really demonstrative of the effectiveness of naturopathic medicine?
Well, one case I had a few years ago, the patient, a woman came in, she was actually a nurse, and I've had several nurses come in, they like that I have a nursing degree that makes them feel more comfortable. But she came in after having had a couple of surgeries, abdominal surgeries, and felt like her health was going down, that she may not survive if it kept on that cycle. We really turned things around for her, and it took a while.
What were her surgeries for? Do you remember?
I don't
mean, she had
remember.
hysterectomy or, okay. But she had multiple abdominal procedures done.
Correct.
Okay, and was she having digestive trouble as a result of that, or?
It was really immune system trouble. She kept having abscesses, and that was part of the repeat surgery. Okay. It just was not healing properly. The initial surgery might have been for weight loss, or and then a tummy tuck, and then getting abscesses and not really healing. So her immune system had taken a big blow. And then trying to work and live her life and just with no energy. And so anyway, things were on a downward spiral for her, and she came in to see me, and it took a good 6 months to get things more stable. And then over the course of the next year, she was able to return to work full time. At the time she came to see me, she was working maybe 4 hours a day, a few days a week. That was all she could handle. So yeah, she went back to full-time nursing schedule, which is a pretty demanding schedule, and really felt like that it may have saved her life, and she never needed another surgery. She may have had I believe she had one more abscess that came up, but it was resolved, and we were able to take care of it without doing anything more invasive.
Excellent. I'm guessing nutrition, you think she may have had the bariatric surgery? Is that what you're calling?
Well, it wouldn't have been the complete bariatric surgery.
Okay. Because that's gaining in popularity. Have you had any of, and I know that sometimes people do have some pretty severe nutritional deficits afterwards. Do you have any experience with helping those people to get back to a healthy
I have not
nutritional
personally treated anyone as a naturopath who's had those surgeries, but I know of naturopaths who've treated them with nutritional IV therapy and really trying to heal the stomach and get as much proper digestion going there again, because it really does mess up the whole digestive system and how you absorb your nutrients and food. And so even if you're trying to eat the right things, you're not going to get the same amount out of it as someone with a full stomach.
Mm-hmm. Right. Okay, and one more question. You mentioned chelation therapy. Mm-hmm. Maybe I've a little bit of familiarity with that. I wonder if the audience does. Could you maybe just tell us a little bit about that?
Well, chelation is used for two different things. There's chelation for cardiovascular health, which is, chelation means grabbing. So you chelate, you pull out things from the body. And with cardiovascular chelation, we're pulling out excess minerals in the blood vessels to help them be more compliant, more resilient, and able to move better, so they don't get that stiffness. Okay. And with the other type of chelation, and this is something I do a little bit more often, is heavy metal chelation. So nobody's ever come to me saying, I have heavy metals. What they do is they come in and they have all these symptoms, and I'm looking at their history, and maybe they were playing with mercury balls as a child, maybe they have a lot of dental fillings. Yeah, so I mean, we all have exposure to some degree. Some people have a lot more. They may have lived next to a smelting plant, and I'm looking, oh, well, you have chronic fatigue syndrome now, and you used to, for 6 years, you lived next door to a smelting plant. Let's check what your heavy metals are in your body, and if they are high, and if they can handle it, physically, because a lot of people are too weak. We have to build them up first. But if they can handle, we'll do chelation, try to pull those metals out of the body.
Excellent. Okay. Well, great. Well, thank you so much. I think that gives the audience a nice overview of your practice. And if anyone was interested in working with you, what would be the best way for them to reach you?
You can find me online at salubrio.net. That's www.salubrio.net.
Okay, great. Well, thank you so much for coming on. I really appreciate it.
Yeah, it's been fun.
Okay, it's time for Desert Island Books. This is our weekly book review. If you were stuck on a desert island and you had all the essentials taken care of, food, shelter, water, clothing, etc., and you had some room for some luxury items, these are books that you want to have with you. This week's book is Beyond Mind, Beyond Death. This is a compilation of the work of quite a few authors, actually. Most of them are students of a man named Richard Rose, who was an enlightened fellow. He lived in West Virginia. He only died about 5 years ago. But Richard Rose was very interesting. He's written some books also, but I haven't found his books as accessible as this one, written by his students. Anyway, Mr. Rose woke up outside of any tradition. I call him a rogue realizer. He wasn't a Zen guy, he wasn't a yogi, but nonetheless, he had a bunch of students, and a number of these guys have gotten together and written this book. And what I'll say about it is, it's probably the most practical, spiritual guide that I've come across. These guys are really trying to point out the pitfalls of spiritual practice and provide some encouragement along the way. And it's just wonderful. There's maybe 50 or 60 different essays in here of varying length, but I can highly recommend this book to anyone who is a seeker, who's interested in trying to wake up in this lifetime. Beyond Mind, Beyond Death. It's put out by the TAT Foundation. Check them out online too. They have a lot of good stuff online also. This book definitely gets Dr. O's Golden Stethoscope Award, so check it out. Okay, it's about time to wrap it up, time to give thanks. First of all, I want to thank John, the producer. Without him, the show doesn't happen. I also want to thank the head crew today. That's Ivy Lau. Appreciate your work. Thanks to Quote Unquote for giving us the airtime. Most of all, I want to thank the viewers for watching. If you're enjoying the show, come back and check us out next week. Tell your friends about it. You can also check us out online at www.pathstowellness.net. If you have any questions, comments, or suggestions, you can send them to me at dro@pathstowellness.net. Also, one last time, I want to thank Karla again for coming on. We really appreciated having her on. So we're going to wrap it up. Before we do, we'd like to leave you with something to chew on. We call it the Cud. This week's Cud comes from the enigmatic Jed McKenna, who wrote, "Enlightenment is your destiny, more certain than the sunrise. You cannot fail to achieve enlightenment. Were you told otherwise? Irresistible forces compel you. The universe insists. It is not within your power to fail." So we're out of here. Until next week, remember, it's your body, learn to care for it. It's your mind, learn to focus it. It's your heart, learn to awaken it. Peace, y'all.
Keep on